When the ventral striatal activity is low, there is greater childhood hyperactivity and impulsivity. Now, this is really interesting because one of the postulated hypotheses is that this hyperactivity and impulsivity is a way of increasing dopamine in the ventral striatum, where this ventral striatum dopamine is actually low, because we know that any sort of activity can actually increase dopamine. So what this tells us is that hyperactivity and impulsivity may be a form of self-medication in individuals with ADHD. In this video, I'll give you an overview of the brain changes in ADHD. Now, it's important to recognize that ADHD is a disorder of neurodevelopment and also changes through the lifespan. With regards to brain changes, the brain is constantly changing throughout life. One of the issues with what we're going to go through as part of brain changes is to recognize that not all of this is replicated. Two, these are not consistently identified in every single individual with ADHD. There is a huge degree of heterogeneity. But what this tells us is that there may be some key areas of commonality across ADHD presentation. So when we go through these brain changes, please do recognize the uncertainty in brain changes overall. The most consistent finding in ADHD has been an overall reduction in total brain size, with specific changes in the caudate nucleus, part of the striatum, the movement area, prefrontal cortex white matter, corpus callosum, and cerebella vermis. Having said that, does not mean that this overall reduction is present in every single individual. But what's striking here is that the parts of the brain that are involved are responsible for cognition, attention, organization, movements, and this is where aspects such as hyperactivity are present. Next, Swanson in 2007 noted that the caudate nucleus and globus pallidus, both key components of the striatum or basal ganglia, are smaller in ADHD. Now, both of these areas actually contain a high density of dopamine receptors. So again, it sort of connects the key striatal areas with dopamine, and these tend to be smaller in individuals with ADHD. Next, ventral striatum, also sometimes interchangeably known as nucleus accumbens, which is a key part of the reward pathway, tends to be reduced in ADHD. And there is a negative correlation between the ventral striatum and childhood hyperactivity and impulsivity. What this tells us is when the ventral striatal activity is low, there is greater childhood hyperactivity and impulsivity. Now, this is really interesting because one of the postulated hypotheses is that this hyperactivity and impulsivity is a way of increasing dopamine in the ventral striatum, where this ventral striatum dopamine is actually low, because we know that any sort of activity can actually increase dopamine. So what this tells us is that hyperactivity and impulsivity may be a form of self-medication in individuals with ADHD. It's a mechanism through which the individual is trying to attain reward. Next, there is a reduction in cortical thickness, which is associated with the DRD4 allele. Now, this DRD, dopamine receptor 4, we know plays a crucial role through its connection with the pyramidal glutamate neurons. And we know glutamate plays an important part in cognition in the prefrontal cortex. This thinning resolves in adolescence and is associated with a better clinical outcome. Then, the frontostriatal circuit has been convincingly implicated in ADHD. This is a circuit that plays an important part in many disorders such as depression, particularly the more severe forms of depression, OCD, and of course ADHD that we're just talking about. There are three key components of this frontostriatal circuit. First is the affective loop, also known as a limbic loop, and here there are connections between the ventromedial prefrontal cortex and the orbitofrontal cortex to the nucleus accumbens, the reward pathway. This is predominantly modulated by dopamine projections from the VTA, ventral tegmental area. Next, the cognitive loop. Here, there are connections between the dorsolateral prefrontal cortex, which we know is the seat of the executive function area of the brain, and the caudate putamen, again modulated by dopamine projections from both the ventral tegmental area and the substantia nigra. Finally, the motor loop. Here, there are connections between the premotor cortex, the supplementary motor area, and the putamen, again modulated by dopamine. In ADHD, fMRI has shown reduced activation of the prefrontal cortex and the striatal regions, both areas where dopamine plays an important part.